Okay, I'm going to do the head to toe assessment. The first thing I'm going to do is review the chart for allergies and diagnosis, and if there's anything important I need to know for the patient. Welcome in. Hi, Mr. Smith. My name is Laura, and I'm going to be your student nurse today. I'm going to do a head to toe assessment. Is that okay?
Yes.
Is there anything you need to do before we get started, like go to the bathroom or anything like that?
No.
Okay. I'm going to go ahead and do my hand hygiene. And get my gloves on. How are you feeling today, Mr. Smith? Do you have any pain?
No.
Good. Can you give me your full name and your date of birth? Mr. Smith is fine.
Mr. Smith, 3/17/76.
Perfect. Do you know where you are today?
Yes.
Where are you?
St. Francis.
Why are you here?
Appendicitis.
Can you tell me the year?
2019.
Perfect. All right. I'm going to get a baseline for your blood pressure and then get some vital signs for you. I'll raise your bed. It'll take a while because I'm tall. Okay, I'm going to get the baseline blood pressure, whatever number with the radial pulse stops. Add that to 30. I would do respirations and pulse over the chest for 60 seconds apiece. And then I would take a oral temperature with the sheath on, come back and take the blood pressure. Okay, Mr. Smith, your vitals are all good and you've already stated you didn't have any pain. We're going to go ahead and start with the head to toe assessment. I'm going to start with your head. I'm going to feel around. My patient is alert and oriented ×4. Hair is clean, evenly distributed, thick. And then we're going to come down to the eyes. Pupils are equal. I would turn off the light. And then I'm going to check for reactant to light. There's going to be a light in your eyes. Perfect. Lights would come back on. And then I'm going to check around your eye, your conjunctiva, make sure that everything is moist and pretty pink. Eyes are symmetrical. I'm going to check your ears. Skin is dry, clean, and intact. Can you hear that?
Yes.
Perfect. I'm going to check your ears for drainage bilaterally. Then I'm going to go down to the nose. I'm going to look up. Nose is symmetrical, no drainage. I'm going to check for patency. Blow out. Blow out. Thank you. I'm going to feel around the face. Skin feels good, warm, dry, intact. All right, Mr. Smith, I'm going to check your mouth. I'm going to use my tongue compressor. Teeth are all there. Skin is good, intact, wet or moist, pink. I would discard this. And then, can you smile for me? Face, eyes, ears, nose, mouth is all symmetrical. And then I'm going to go down to the neck, feel for lymph nodes. Skin is clean, dry, and intact. Warm to touch, lymph nodes are good. And then I'm going to come down into the trunk. And then I'm going to feel around for masses, lumps. Skin is warm, dry, intact. And then I'm going to listen to your heart. I would take an apical for 60 seconds and note rate and rhythm. And then I would listen to the lungs for each respiration, move. I would check the sides. And then I would have him turn over. Of course, still have my stethoscope on. If I can get it back on.
10 points.
Listen to his back of the lungs. Lungs are all clear, CTA even, unlabored. I would check the spine, soft S curve. Skin is warm, dry, clean, and intact. I would ask, I would look at his rectum for hemorrhoids, clear in this case. And then I would come back up. And I would do his abdomen. Inspect. Skin is clean, dry, intact, and warm. Listen to the 4 quadrants for a minute. Bowel sounds in all 4 quadrants. Softly palpate abdomen, checking for distension, tenderness.
No, none of that.
That's always a good thing. Okay, so I did forget something. I got it. I didn't fill the cart properly. The artery in the neck. So I'm going to go back and do that. I'm going to fill. It's strong and regular. Strong and regular on both sides. Then I'll listen. Strong and regular. Strong and regular. Now I'm going to go to the arms. Check the skin. Warm, clean, dry, and intact. And then I'm going to do brachial, strong and regular, radial, strong and regular, bilaterally. And then I'm going to have him do range of motion, moving arms up in circles. He can do that actively. And then I'm going to check for cap refill in both hands, under 3 seconds bilaterally. And then grip test, both sides, strong on both sides. Turgor is good on both sides. Range of motion on both sides. Skin good on both sides. Put that up. Move to the lower. I would ask, we'll ask him a bowel movement. And void it and ask if there was any abnormalities with those and when he did them last. So for the legs, I would go from femoral, popliteal, posterior tib, and dorsalis pedis. all bilaterally are strong and regular. Range of motions for both legs. Skin clean, dry, intact, and warm to touch. Cap refills in both feet are under 3 seconds. Foot strength strong on both. If it were a woman, I would ask last menstrual cycle. And that completes the head to toe. Mr. Smith, is there anything else I can do for you while I'm here, making you comfortable?
Yeah, I think I'm fine. I just need to sleep.
Seems like there's a lot of people bothered you.
Oh, for sure.
Had like 6 head to toe assessments today.
On one day. And then I would get the call light. Okay, Mr. Smith, thank you for letting me take care of you. I would discard my gloves, let them away, hand hygiene, leave and document.
Okay.